It's health assessment time again. In this video, we will review program basics and highlight some important changes to the program for the upcoming fiscal year. If you are an employee or spouse covered by the city or school's health insurance plan, participation in the health assessment program is encouraged and will result in a discounted insurance premium. Non-participation or non-compliance will result in paying the regular insurance rate. Let's get started. Health assessment orientation packets are available on the city and school websites. Please review the packet and share with your spouse as it will go into detail concerning program changes for the year and assessment dates. If an orientation session has been scheduled for your department, please attend and invite your spouse to join us. The Health Risk Assessment Survey will be available beginning July 1st of 2020. This step must be completed at least 3 business days prior to your scheduled assessment date. Please refer to the orientation packet for complete login and survey completion instructions. Scheduling your health assessment. You will be prompted after completing your online wellness survey to schedule your assessment or biometric lab review appointment. Assessment dates will be available every Tuesday and Thursday beginning July 7th through October 31st, 2020. There will also be some Saturday appointments available. All available dates will be open for all city and school employees, spouses, and retirees. No makeup dates will be offered this year, so please schedule early as appointments will be given on first-come, first-served basis. You will schedule your follow-up consult appointment. This is either a phone call or in-person appointment with a wellness nurse or dietitian to review the results of your screening at the time of your assessment. Biometric lab review appointments will be offered Monday through Friday beginning July 7th through December 31st, 2020. There will be some Saturday appointments available. Please refer to your orientation packet for the new survey website and instructions for logging in. Your assessment appointment will be located at the Business Health Office at 403 Princeton Road, Suite 3. Our office is located in the same building as the Employee Health Clinic. Please fast 8 to 10 hours prior to your appointment time for accurate lab results. Fasting means no food or drink besides water or black coffee, no chewing gum or candy, and no smokeless tobacco. You may take regular medications as long as your medication does not require you to eat, for example, insulin. Please drink plenty of water to keep yourself hydrated. This makes obtaining labs much easier. Assessments will include a blood draw for lab work and a basic biometric screening including resting blood pressure, heart rate, height, weight, and calculation of body mass index. Using your labs from your primary care provider will continue to be allowed as long as they are within 90 days of your appointment date and include a fasting glucose and lipid panel. Participants that are using labs from their PCP will need to choose the biometric lab review appointment option online when scheduling. These appointments will be conducted at the Employee Health Clinic with a nurse or a dietitian and will include the basic biometric screening as well as consult. 2020 through 2021 program risk factors. 1. A body mass index or BMI greater than or equal to 30. 2. A resting blood pressure greater than or equal to 140 systolic or greater than or equal to 90 diastolic. 3. HDL cholesterol less than 40 for men or less than 50 for women. 4. A fasting blood sugar level greater than or equal to 100. Participants with an elevated fasting blood sugar without the diagnosis of diabetes have the option of obtaining an A1C lab test at their PCP office or the employee health clinic. If the A1C result is less than 5.7, the risk factor will be removed. The result must be turned in to the wellness nurse with 4 weeks of the consult date. Five, smokes including e-cigarettes or use of smokeless tobacco. 6, less than 150 minutes a week of moderate physical activity. 7, more than 2 years since last physical exam with a primary care provider at the employee health clinic or at urgent care/walk-in clinic. DOT and OSHA physicals cannot be substituted for an annual physical. You must complete your consultation appointment with the nurse or dietitian to receive your health assessment results and stay compliant with the wellness program. The consult appointment can be scheduled at your assessment appointment. This appointment can be in person at the employee health clinic or by telephone and must be completed by December 31st of 2020. If you miss your scheduled consult appointment, you will be allowed to reschedule one time. If you miss your appointment twice, you will be marked non-compliant for the year and your premium will be adjusted in January of 2021. A wellness plan overview and lab results will be mailed to participants following their assessment and will be reviewed during the consult appointment. Please have any questions about labs or wellness plans ready as we will answer them at your scheduled time. Wellness plans and requirements. If you have 3 or more risk factors or a fasting blood sugar risk factor without a diagnosis of diabetes, you will be assigned a wellness plan. Wellness Plan 1 is for participants with 3 to 4 risk factors and or an elevated fasting blood sugar without a diagnosis of diabetes. Included in the plan are 3 required health coachings with a nurse or dietitian, completion of a food log and activity log, and proof of a yearly physical with your PCP. Wellness Plan 2 is for participants with 5 or more risk factors. This plan requires 4 health coaching sessions with the nurse or dietitian, completion of a food log and activity log, and proof of a yearly physical with your PCP. Health coaching sessions will provide individual health and wellness education. The first session must be in person. The subsequent sessions can be in person or by phone. For Wellness Plan 1, health coaching appointment number 1 must be completed by March 1st. Health coaching appointment number 2 must be completed by May 1st, and health coaching appointment number 3 must be completed by the program end date of June 30th. If a participant is assigned Wellness Plan 2, their first appointment for health coaching must be completed by March 1st. The second health coaching appointment must be completed by April 1st. Health coaching number 3 must be completed by May 1st, with the final health coaching appointment being completed by the June 30th program end date. All documentation for points must be turned in by June 30th, 2021 to stay compliant and continue receiving your discounted insurance premium. Please contact your HR department or the wellness nurse with any questions or concerns. And let's get started toward making this year your healthiest yet.